I had a liver transplant because of Hep B. Here's what you should know. Today I will share a story of a chronic hepatitis B person who shared his painful story and how he is living after liver transplant. 2 years ago, suddenly Peter V had a 7-hour emergency for liver transplant. This is because after a chronic hepatitis B infection in the long run led to rapid liver failure. This interview was with Peter V and Hepatitis B Foundation team. The team said, Peter sat down with us and shared an in-depth look into why he needed a liver transplant and how it changed his life. So, let's go to know about Peter V's story.
Why did you need a liver transplant?
I had acute liver failure. About 1.5 years before I was suffering from liver failure, I was taken off the hepatitis B medication called Viriad as per my gastroenterologist's suggestion and to maintain blood work monitoring about every 6 months. Since June 2017 to January 2018 my liver failed and condition was worse. Besides, my HBV DNA was going on high from 1000 IU per liter to 169 million IU per liter, along with ALT was gone high from 24 IU per liter to 4419 IU per liter. This was the indication that my liver had completely been destroyed through cirrhosis. This was happened because of without antiviral medication. When the virus gets flared up, when I came to know, there was too late as in my case.
What did a liver transplant mean to you previously? Did you realize how serious the procedure was?
I never thought about a liver transplant, or any transplant for that matter. I never thought I would need one in my life. Before transplant, my life with hepatitis B was normal and routine was also going on fine. Hepatitis B was simply a part of my life, I did not care. I was following up the treatment and medications as my doctor prescribed, there was nothing, any side effects or any complications. But this liver transplant was really a big surprise to me, which I did not expect in my life.
Have you ever heard about liver transplant before?
Heard, but I didn't understand how serious a transplant was. My condition deteriorated rapidly when my liver began to fail. I could not even do basic activities like unlocking my phone, wearing my clothes. Then I feel while my situation was so severe that time, I was totally in unconsciousness. I didn't even know when they were taking me into surgery unit. After some days, when my cognitive function of the body came back, my wife informed me that my situation had been extremely critical.
What kind of treatment and follow-up did the transplant involve?
I was bedridden and unconscious for over 2 weeks after the liver transplant. I was needed physical therapy to regain my strength. For 2 weeks, I had therapy 3 or 4 times a day to regain my ability to speak and cognitive thinking. Blood work is also a big part of follow-up. In the beginning, I had to have my blood taken daily before it lessened to once a week, then once every 2 weeks, and eventually to once a month.
Does after transplant liver suit you?
About a year ago, my ALT was so high. My post-transplant team took a sample of my liver and found that my body was rejecting the new liver. They increased my anti-rejection medications and my body was able to adapt.
What other side effects did you notice?
In between, I also developed diabetes after my transplant and had to be placed with insulin. However, I was able to stop taking it by changing my diet and monitoring my blood sugar through my eating habits.
How has the liver transplant changed your life?
I don't drink alcohol at all anymore, and I take much better care of my body. Before my transplant, I didn't take hepatitis B seriously. I was still drinking alcohol and not eating a healthy diet. The transplant made me realize how serious hepatitis B could be if you don't take care of your liver.
Are you still able to carry out daily activities the same way you did previously?
The anti-rejection pills suppress my immune system, which means I have to be very careful about what I eat and how it is prepared. Eating out at restaurants is a risk because you have to trust that the restaurants are properly cleaning their food and that it is cooked properly. Because of the immunosuppressants, improperly cleaned food can be dangerous. One time I developed a fever and had to be hospitalized because of cross-contamination between foods at a restaurant. You really have to be aware of what you are eating. During the COVID-19 period, doctor told to wash your hands thoroughly and not touch your face have been my life since the transplant. Eventually, these actions become a habit. I am still able to work and do physical activities like yard work and exercise, but it is not as vigorous as before. I still get fatigued throughout the day, but it doesn't stop me from living my normal life. I am still able to work and do physical activities like yard work and exercise, but it is not as vigorous as before. I still get fatigued throughout the day, but it doesn't stop me from living my normal life.
Is there anything that you wish you could have changed about your experience?
I didn't expect to have liver to go through the transplant. I knew more about how serious hepatitis B was. I still drank alcohol and ate the same foods that I ate before my diagnosis. I neglected my liver health. I wasn't serious about it before the transplant. Hepatitis B was invisible to me. It shouldn't have taken a liver transplant for me to become aware of it.
What have you learned since your journey?
I don't think that a liver transplant is an option. For me, it was life or death. Because I was in critical condition, I was able to get it immediately. For others, getting a transplant is a long and difficult journey.
Do you have any advice for those living with hepatitis B who think that a liver transplant is the best, or only, option for them?
A liver transplant is not going to get rid of chronic hepatitis B. You will still live with it. Hepatitis B is still a part of my life every day. Now I understand what I did to my liver. Chronic hepatitis B is not life-ending. It can be treated and under control, and you can enjoy your life too. I put my friends and family through a scary experience. If you have chronic hepatitis B, take care of your liver and pay attention to your liver, as well as follow up your treatment as your doctor suggested you.
When liver transplant required?
A liver transplant is a very serious major surgery that removes a diseased or injured liver and replaces it with a healthy one. People living with hepatitis B can need a liver transplant if their liver begins to fail.
What is your hepatologist says?
Liver transplant is not the solution. Keep monitoring your liver on regular basis. Do required tests as your doctor suggested. Take medications if your doctor suggested. Follow up your treatment in every 6 months or as your doctor suggested. Above these points can help prevent the need for a liver transplant.
Finally, we would say, a big hand up to you, Peter. Thanks a lot for sharing your painful story. We hope your story will be inspired by all the patients and look into your experience seriously. If you like this video, please like and share this video more and more. Please support our channel. Thanks for watching Great Wisdom Discover. We will meet you with new update in the next video. Thanks for watching Health Wisdom.